Hello, Healing Spot community. This is Justine Calderwood. I'm a physical therapist here at the Healing Spot, and today I'm talking about ways to keep your bladder happy. So I work with a lot of pregnant and postpartum moms, and postpartum's forever, so I work with a lot of older moms as well that haven't necessarily have had kids recently. So these tips can be used for women of all ages, really, and men as well. So first, I'm going to start with just some tips on proper breathing. So one thing that you can do is make sure that you're breathing with your diaphragm. The reason for that is because we want to basically keep the intra-abdominal pressure from putting too much pressure in through your bladder. So proper breath control and learning that can be super helpful if you have some bladder issues like leaking or bladder pressure or feeling heaviness into the pelvic area. You may have some prolapse symptoms where you feel like things are going to fall out. So all of these can be helpful for controlling that intra-abdominal pressure, or how much pressure is put down through the pelvis and putting in through the bladder. So you can do this simply by even just lying down, putting one hand at your chest and one hand down here at your abdomen, and just checking in with yourself to see, without altering, just to see how your breath is, and see if you're able to expand through the rib cage and front to back. Okay, so it's different than belly breathing. We don't want to just inhale and bring a breath down into the belly and kind of bypass that a little bit. And we don't want to be breathing into these muscles up and through here, these accessory muscles. We really want to be expanding down through. So the diaphragm is part of the inner core. So being aware of your inner core and using it for your advantage. So basically making sure that you are strengthening it, but also learning how to relax it as well. Okay, so inner core muscles are the diaphragm from the top, so it kind of works like a canister. Diaphragm from the top, the pelvic diaphragm or the pelvic floor from the bottom. The transverse abdominis muscles, those are real low. They go transversely across your lower abdomen and attach onto the thoracolumbar fascia of the back. And then the multifidus muscles, or the multifidi. I have this diagram here. I'm a member of Pelvic Guru, their directory, and I get access to some really cool illustrations. And so this just shows the diaphragm here from the top, your pelvic floor from the bottom. So this is a cross section, kind of looking at from the side. Then you can see your transverse abdominis muscles that create a sheet like this. And then the multifidus muscles are really those little muscles in your back. These are all stabilizing muscles, okay? So when I work with people that have bladder issues, we start with breath, and we start to activate these muscles, okay, which I'm not going to go into right now with you. If you are interested in getting some more information on that, I'd be happy to share. Just reach out to me, comment below. I have a really good article that I share with my patients, as well as I use for myself. I know there's a lot of great online courses out there that teach about core strengthening. I'm not, right now, I'm not in a position to be endorsing any particular program. I work with people one-on-one. So let's see. As a certified birth healing specialist, like I said, I do work with pregnant and postpartum moms. I recommend getting assessed by someone, especially if you're postpartum, to see, because the bladder can get off center, okay, because of how baby is positioned while you're pregnant, and also any restrictions that might have been there pre-existing, okay. So this doesn't happen necessarily just with during childbirth or afterwards, but the bladder can be pulled off center, and that can really affect the ability for your pelvic floor muscles to be contracting. Pelvic alignment can really affect the bladder function as well. The uterus, if you're female, the uterus, that being pulled off center, that can have an effect as well. So getting that checked out by somebody that's trained in pelvic floor physical therapy is a really good advice, I guess, for you to look into. Myofascial release is a treatment technique that I use that I found really good success to be able to release the fascia. So fascia is just our connective tissue, and it's got to be able to slide and glide. And if you think about your bladder being, a sac, and it's got to be able to expand, and it's also got to be able to contract back down, okay? And so restrictions in that soft tissue around the bladder itself can really affect the ability to expand properly and fully, and also to be able to empty, okay? I'm kind of keeping it simplistic simplistic, but that soft tissue can be released around the bladder. So that can be done externally. I do a technique where I have somebody sitting on the edge of the bed, and I can go in just above this pubic bone basically and help to release. It kind of come in and down, but it can also be done internally, intravaginally, where we can come from the bottom and kind of release it external and internal at the same time, and it works really, really well. Okay, you can use a small ball. Okay, by using a small inflatable ball, lying down on top of it and just putting it just above, just find your pubic bone and you can put that just above, and if you lie on top of it, that ball can serve as a very gentle way of releasing the fascia. So you can do that at home if you can lie down on your stomach safely and easily. I would recommend that to try that for 3 to 5 minutes and just see if it helps, okay? Let's see, the last thing I'm going to say is just there's certain bladder irritants. So looking at your diet can be something that may be helpful for you as well. So some of the things that can be irritating to the bladder are carbonated beverages, alcohol can be, tea and coffee, acidic fruits and foods. So like think of your citrus fruits like lemons and grapefruit and even strawberries. And then also tomato-based foods and chocolate. So nobody likes to hear that, right? I don't anyway. So looking at your diet, so one thing that you can do is even keep a bladder diary and see, you know, what is your issue? I know I'm keeping this real simplistic, but what's your issue with the bladder? Are you going too frequently? Do you feel like you're not emptying? Are you leaking and having accidental, having accidents, that kind of thing. So, and then I'm just going to finish with just saying one thing that can be helpful when you're doing some bladder retraining is making sure that you're not going to the bathroom just in case. So it kind of it messes a little bit with the reflex and in your body's ability to recognize whether your bladder is full or not. And so going to the bathroom just because you're leaving the house is not really a good idea, and teaching your kids to do that is not a good idea. So I did not know that because I was not a pelvic floor physical therapist when my kids were little, and I erred by always having them go to the bathroom. Just go to the bathrooms. I didn't want the inconvenience of stopping or whatever at a gas station. So going to the bathroom just in case is not a good idea, okay? All right, thanks for tuning in today, and if you have any questions, please leave them for me. I'll get back to them, and be on the lookout. I'll be creating some information in a blog post later this week. Okay, you can check that out on my website at healingspotpt.com. So, all right, happy Tuesday.